So moving on to the sense of vision, this is our primary sense. 70% of all the sensory receptors that we have are the photoreceptors of the eye. And the eye is protected by a cushion of fat and the bony orbit. So if you feel around your eye, you can feel the facial bones that are creating that orbit. And then you can also feel cushion of fat around all of that. Eye anatomy, the sclera is the white of the eye. The cornea is like the window of the eye. That's how light first enters into the eye. The aqueous humor is a clear fluid that fills the space between the lens and the cornea, and it functions in providing nutrients to the eye. The iris is a colored muscle which regulates the amount of light entering the eye. The iris is basically controlling the pupil. The pupil is the opening in the middle of the iris. So as the iris changes size, as it contracts or relaxes, it's going to allow different amounts of light through the pupil and into the eye. The lens focuses light on the retina. The ciliary body contains muscles to help focus the lens. They can actually change the shape of the lens, which allows different focusing to occur. The vitreous humor is the clear gelatinous substance filling the central cavity of the eye, and that pretty much gives the eye its shape. If the eyeball was to be punctured and the vitreous humor were to leak out, the eye would basically collapse. The choroid is the layer containing blood vessels that's located between the sclera and the retina. And then the retina itself is the layer of photoreceptors that's lining the back of the eye. And there are two main photoreceptors. We have rods and cones. Rods respond to dim light and function a lot in our peripheral vision. Cones respond to brighter light and function in color vision. The macula is the area in the retina which allows sight of fine details in the center of our field of vision. The center of the macula is called the fovea. The optic nerve is a bundle of nerve fibers, over 1 million of them, that exits the back of the eye. So it's basically the axons of all those photoreceptors that exit the back of the eye and then leads to the brain. The optic disc is the point of exit of the optic nerve from the eye. And since this is where the optic nerve is exiting the eye, there's no rods or cones in this specific location, and that corresponds to a blind spot in the eye. Since there's no photoreceptors in that location, if something is focused directly where the optic disc is, you're not going to see it. We often have no knowledge of our optic disc or no perception of our optic disc because we have two eyes. If something happens to be focused on the blind spot of one eye, we're going to be able to see it with the other eye. So we don't notice a blockage in our vision. Accommodation is how the eye changes its optical power to focus at different distances. So this gives us the ability to focus on things that are close as well as focus on things that are far away. And this is accomplished by changes in the lens curvature and shape. So the far point of accommodation is the farthest point at which an image is clear. The ciliary muscles are relaxed, and so the lens has a minimum amount of curvature. The lens would be as flat as it possibly can get. And our far point of accommodation is approximately 20 feet. The near point of accommodation is the closest point at which an image is clear. The ciliary muscles are fully contracted, so the lens is at its maximum bulge. And this is about 4 inches for the human eye. So this is a video that you can watch about accommodation. Refraction. So refraction is basically how we're able to focus. Emetropia is when the eye is relaxed, unaccommodated, and focused on an object at least 20 feet away. This is when the focal point is directly on the retina, and emetropia is considered to be perfect vision. There are then refractive errors that are imperfections within the eye that prevent the eye from properly focusing as it would in emetropia. Myopia is when the focal point is in front of the retina. So that means the focus happens before we even reach the retina. And so by the time the image gets to the retina, it's now out of focus again. This can be corrected with a concave lens. Myopia is considered to be nearsighted because you can see things that are close or near, but things that are further away are going to be blurry. So you can see near, but not far. Hyperopia is when the focal point is behind the retina. So the focus would happen after we've already reached the retina. So when it hits the retina, it has not focused yet. This can be corrected with a convex lens. And this is considered to be farsighted because you have the ability to see things that are far away, but as things get close, it is more difficult to focus. Presbyopia is the gradual age-related loss of ability to focus on nearby objects. So this is a natural effect of aging. The focal point gradually becomes farther and farther beyond the retina, and so this is age-related farsightedness. This tends to really hit around age 40, and that's when you notice individuals who may have never needed glasses before suddenly are using reading glasses. Astigmatism is an irregularly shaped cornea or lens. So it's not the normal shape, it's curved differently in one direction than the other. And that creates a distortion of vision because it's going to create multiple focal points on the retina due to that curvature distortion. Depth perception is the ability to perceive the relative distance of objects. And this is due to binocular vision. Binocular vision means we have two forward-facing eyes, which gives us that three-dimensional vision. It's because both of our eyes have a slightly different view of the image that we're focused on. And so our brain fuses those images and it allows us to determine depth in terms of seeing things in 3 dimensions. If only one eye is used, depth perception is lost, and the observer must rely on learned cues to determine depth. Eye diseases, disorders, and possible treatments. Refraction problems such as nearsightedness or myopia, that could be corrected with LASIK surgery. LASIK is a procedure that uses a laser to reshape the cornea. Cataracts are clouded lenses, often due to the aging process or injury. And cataracts can sometimes be treated with the implantation of an intraocular lens to replace the cataract. Macular degeneration is the loss of central vision. It can be due to a thinning macula, that would be called dry macular degeneration, or it could be because of excessive blood vessel growth and leakage, and that would be wet macular degeneration. Glaucoma is when there's damage to the optic nerve due to excess inner eye pressure.